can see, I've been put in a place called the dining room at the old maternity wing at the Victoria Hospital Respiratory Clinic. As you can see, I'm welcomed with a lovely amount of water in the entrance. As you can see that. This is a health hazard. Anybody can slip and fall at night. If the light is turned off and I have to walk through, I can easily slip and fall and hurt myself. I'm a COVID patient. This is where I see a sign, wet floor. This is where the quarters have been put to live. It's not even a normal hospital ward. I can't understand how, as you can see, more and more water. There's water all here on the floor. It's hard to see with the camera, but all this floor is wet. And this is where I'm sleeping. I'm not in a ward. There's just walls around me. If you see the ceiling, it looks like there's water leaking. I don't understand how a human being can tell me I'm a COVID patient and this is the facility they have for me. I think I would rather quarantine at home. This is the beautiful facility that they put me to stay in, expect me to stay here. This is where I have to live. Look at my wonderful counter, my beautiful counter. I feel like I'm in a crack den. The place is not complete. I don't even understand what's really happened. Look, more water leaking in the kitchen. And this is where they've told me that I have to stay as a patient in the respiratory clinic. Disappointment is the light. I don't know what to say. How can somebody take me seriously, look at me and tell me that this is where a patient has to stay with all these health hazards, water leaking through the ceiling, water leaking on the floor. I can slip and fall at any time. That's just crazy. And this is what St. Lucia is boasting, that they have the facility that they have for COVID patients. I cannot understand this. Somebody please explain to me. The whole commanding officers, please, is this the best that you all can do? I have to stay in something called a dining room. That's crazy.